Commissioner. Thank you, Senator. Assembly?
Yes, next up we have rankered Assembly Member Kevin Byrne.
Thank you, Mr. Chair, and thank you, Mr. Commissioner, for being here. Before I get really started, I do want to thank you from earlier on at the onset of the outbreak. The Commissioner met with conferences, both Republican and Democrat, to brief us on the virus earlier in the year, so I do appreciate that. So I want to say something nice before I really got into the weeds here, and I'm glad you came prepared to discuss the March 25th order as well as the DOH report. So let me start out by asking who actually developed this report from the Department of Health that seems to defend the March 25th order?
The report, the nursing home report, was developed by the team within the department. I have, as I mentioned, a lot of epidemiologists. I have physicians and others, and have been working on this since day one. And they worked through the report, looked at the numbers, and as I mentioned earlier, that I stand by all the data in that report because I know there's expert individuals who do it.
Understood, and I do think there's some opinions from my colleagues, like speaking for myself, that it is incomplete in certain instances. The counting of fatalities from nursing homes is an issue. If the department felt it could do a report, I'm actually glad you did. We put forth an amendment in the Assembly at one point to ask the department to do a report, so it's good. I just feel it's missing information, specifically a total complete count. I also had a question about the number. It seems to be heavily reliant on the timeline, and I understand that the two different peaks, but the number 23, the 23 days basically from infection to fatality. My question is, when we're dealing with the elderly and those with the most severe underlying conditions, is it not reasonable to believe that that period would be sped up, that they are not going to have the same time period from rate of infection to fatality as the general public?
I've asked some scientists about that, and it doesn't, so far has not panned out on that. If the individuals are severely immunocompromised, somebody who has had, is on chemotherapy, their white count's 3 and their platelet count's 20,000, all these other medical problems I go through, then the virus may hang around a little longer. That's something, but it's a very small percentage of the population. Back to the
Mr.
report.
Commissioner, I want to ask, but we just have a limited amount of time, so I'm sorry to interrupt. But sure. I just want to point that out. That's a concern, and I know there's anecdotal evidence, people that have succumbed to this virus fairly quickly, so there's obviously highs and lows to this. Going back to the actual March 25th order, I'm glad you said that words have meaning, and that's important. I think we believe that as policymakers and as lawmakers. And you cited the New York State Codes of Rules and Regulations 415.26. I know the governor has mentioned this. I'm not sure if you have the March 25th order, but can you point to where in the order it actually cites CDC guidance or the New York State Codes of Rules and Regulations in the order?
So two things. One is, I don't have it sitting right in front of me, but two things. One is, on the report, just so you know, it has been reviewed by outside experts as well, so it's sort of peer reviewed as well. So that's part number one. Number two, these codes and these statutes, 415-26, that has been around since 1992. They know, these nursing homes, everyone knows that you have to provide the necessary and adequate care. So this is just a basic underlying understanding of the nursing homes, and for that matter, all other facilities, Article 28 facilities. So I think that,
Commissioner, I'm sorry, we're just running low on time, but I understand that, and I thank you for your answer. But as we craft policies in the state legislature and other orders and directives are disseminated, I mean, we are dealing with this pandemic where the governor has had to, in many cases, rightfully suspend certain state laws. So I think this is a very, high pressure time. We pass laws and policies where we always say things, not always, but oftentimes, not to conflict with state or federal law. I didn't see that anywhere in the order. I also saw, we used the term advisory or guidance, and I know the report mentioned some of the CDC guidance, but this uses words like must and shall. Do you think that if you had to do this over again, it's still a standing order, although I can't, or standing document, although I can't find it on the Department of Health website, would you consider revising it or rewording it if you had to do this over again?
The guidance was put out there in the effort to make sure we did not discriminate against those who are COVID positive. That was the purpose of the guidance. And at a time when our numbers were going up dramatically and we could not predict what was going to ultimately happen with projections at 140,000 cases, that's where we were at a time when, remember, we didn't have the testing capacity of 80,000 individuals. So we have to always remember where we are. The guidance is still in place and it's still there. We have other things that we now can do, including testing at the capacity, as I mentioned. And so we can provide
Thank you,
testing.
Commissioner. Thank
I
you,
know, why isn't it
Commissioner.
on the website?
Thank you,
though?
Assembly Member. Thank you. Your time is up. I recognize myself for